All right, ladies, it's Wednesday. It's April Fool's Day. And so why would I not choose to have our COVID pregnancy update on a day like April Fool's Day? Because, right, we can't make up this crap that's going on out there in the world right now. So the April Fool's is on us. Let me get you a little bit better view here. So right now, we're in the clinic and I'm actually hiding myself in a room so I can do this video. I think I have dog hair all over me, or it's on the computer or something. I don't know. God only knows right now. Okay, let's do our weekly update for my prego chickies. So, okay, I gotta clear the air about something though, because last week, apparently, we started a big generational discord, and I'm not talking about the COVID virus. I am talking about the use of the phrase bust a nut. And we polled everyone in the office because some people made comments that I use the phrase bust a nut. And so I was like, what's wrong with using bust a nut? Like, I always use the word bust a nut. I mean, and then anyone that was under 40, which is barely me, but it was under 40, was like, okay, yeah, that means to jack off. And everyone over 40 was like, no, it doesn't. It means to work hard. And I was like, what is going on? This is crazy. Okay, so for the record, when I said we were busting a nut, I was using this definition. The expression bust a nut variously means to be excited about something, to lose your temper, to work hard, or ... to orgasm. All right, so the way I meant it, just be saying for sure, was I meant we were working hard. All right, there is no, trust me, girls, there's no orgasming anywhere right now, okay? I don't know, maybe you guys are, but the rest of us are all busting a nut in the old-fashioned way. I'm talking like old school way. So now I just dated myself. Great, okay. So I'll try to be cool with the young hipsters today and not use something that's maybe, I don't know, either funnily offensive or something. Okay, so here's our update. So we're now in week 3 of COVID Watch, DFW area. So if any of you are watching from other places, because I know this video gets shared, I don't have particular data on your area, but here is some of the news. There are 3 hospitals that we go to in Frisco. Centennial took away circumcisions earlier last week and then decided to reinstate them. So circumcisions, a big question for a lot of moms, are still being done at all 3 Frisco hospitals that we attend. So if you're worried about your son, obviously this only applies to my little baby boys, circumcisions are still being done in the hospital if we can do them. So that I do not foresee that changing at all right now. All right, number 2, visitor policies. Visitor policies for the entirety of the hospital. So I've been a hospitalist now at 2 different hospitals in the past week. The hospitals are empty, like eerily empty, dead, maybe dead's not a good word, empty ghost towns kind of a people, because the visitor policy has been so stringent. At this time, Medical City Frisco tells us they are allowing partner or spouse in, but no birth support team can come in. Texas Health Frisco is still allowing doulas or a birth support person that is a legitimate birth support person along with a spouse or partner at this time. Now, we had a patient that went to Texas Health Frisco the other day, and keep in mind that the information's like coming fast. Like, I've had 6 emails today from 3 hospital systems, and we're like, I need like a whiteboard grid to figure out, because we're like at DEFCON 3 now. So the nurses actually told her, no, your doula is not allowed. They called us, we called the hospital administration, and the nurses were told no, that was an exception to the policy. So don't panic, because panicking lowers your immune system. Right now at Texas Health Frisco, doulas are still allowed in. Medical City Frisco, Baylor Centennial, those are the hospitals that we generally attend, are not allowing anyone besides the partner or the spouse. All right. What do we know? As of right now, From what we know, there is no active COVID infection in a pregnant woman in the DFW area. For some reason, even though swine flu back in 2009 hit pregnant women hard, much like the SARS and the MERS, and you may have heard about these words, these were other pandemics that have happened in the last few years. They happen all the time, just don't usually hit us. They likewise did not seem to hit pregnant women quite as hard. The data shows that there's not fetal transmission at this time. Remember, all the data we know about this virus, because it's brand new, is limited. But there's researchers all over the country that are doing kind of in-depth research, and it's anecdotal right now because we don't test in pregnant women. But as of right now, we don't see any fetal transmission from mom through the placenta to the baby. Most of my, from what I'm reading, babies that have been infected have happened postpartum because the mom has tested positive. All the hospital systems are taking COVID positive moms 32 weeks and greater. So that'd be Texas Health Frisco and Medical City Frisco. It does require isolation because we don't want to infect other pregnant moms. So there's an isolation room at both hospitals, and does not mean you're isolated from our love. It just means you're isolated from the general population. So to protect you and the baby. At that point, usually partners will be asked to leave and protect themselves. We are changing clinic hours for the next few weeks. And of course, we'll keep you updated on this as well. Right now, really, we're trying to limit elective things in the clinic. So you'll see that while our 6-7 providers are here, they're not always here on the same day. There's a lot of deliveries this month. And so we're trying to keep all of our providers healthy, because if one of the providers goes down, we have to all go down and shut down the clinic, and we don't want that. So for the next 3 weeks until the end, really 4 weeks, I guess, until the end of April, which is what the governor announced yesterday, we will be open in clinic from 9 to 3 every day, except Friday, which will be normally 8 to 2. There will be people available after hours and before clinic for telemedicine calls if something is urgent to be done, and on the weekends and on the evenings. So if you're afraid that you're sick, there's a problem, you're going to email beagreatwoman@gmail.com. That's beagreatwoman, not women, woman, @gmail.com, and someone will get you in touch with a provider after hours. Now, the other thing is that our answering service is jacked up. It has been jacked up for years. So don't call us and try to leave a callback number. Instead, just go to the web and go to our website, and you can enter in your information there, and a nurse can call you back right away. So that's really important. Use the web. Try not to use the telephone to call us and leave a callback number, because we may not get it. So those things are all happening. Sauna will still be here every day from 9 to 3 as of right now. We are trying to keep you all out of the hospital at all costs. So if you're worried about something, please call us. If you think you're sick, if you think that your water broke, if you think that baby's not moving as much, call us first. Stay out of the ER as much as you can, because there's doom and gloom at the hospitals, and I'm trying to keep you all away from it. Lastly, again, because we are so busy right now with deliveries, and because we cannot have a provider go down, we're rotating through pretty stringently. So we're definitely taking the call schedule significantly. Dr. Sarda is here next week. She's awesome. If you haven't met her, she will be doing deliveries. She'll be the hospitalist on Tuesday. Dr. Lanasa was the hospitalist on yesterday. So you'll see a lot of sharing of duties. That's because we cannot afford to have a provider go down right now, because that means we would have exposed all of each other. And that means that then we have to close the clinic for 2 weeks. We don't want to do that. So we're not being like hiding away, eating truffles or watching Tiger King or something like that. We're legitimately trying to be home with our families and rest, so that when we come to work, we're healthy. The other thing before I go is that all the hospitals are now requiring everyone when they walk in the hospital to wear a mask. So you'll see, normally when I deliver a patient, I don't wear a mask. I don't even wear a hat. I sometimes don't even wear boots, and I get my shoes ruined or my pants ruined or whatever. But now we're all required to wear these things. I know, so it looks like scary, but the moment we walk into the hospital, just like you, we have to put on a mask to protect ourselves and each other. So that is something that is different at all the hospitals. You will have your temperature checked at both hospitals before you walk in the door, and you will hear as well. So you'll wait in your car until you're ready for your appointment, and then we'll call you in. The nurse will check your temperature, and then we'll get you back to your room. So if you can still have your appointments via telemedicine, I highly recommend it right now. The peak of this thing, expected peak for Dallas is probably going to be the 2nd to 3rd week of April. So we're not even in the peak of it yet. So please do your thing, nest at home, hand wash, make food. I want to thank the women that have brought up masks, handmade masks. Like, you guys sew, it's amazing. I only sew skin, so I don't sew fabric. Some people have brought up cleaning supplies for us. It's been amazing. We usually will take our afternoons and we will wipe down the entire clinic, Clorox everything so that it's fresh for the next group the next day. Any questions, please put them on this. I'm trying not to talk too long, but share it with your friends. I don't think there's a lot of OBs out there talking about things. If there's any questions, please put them under this Facebook group so that I can get to them, or have someone from the office get with you, whatever you need. We're all going to get through this. And also today, if you would, just so I know everyone's watching, just jot down your baby's name for me under this Facebook thread, so I can just check on all my little babies out there and make sure everyone's good. And send me a little blue heart for a boy and a pink heart for a girl. We're trying to stay really connected with you guys because we love you. We love taking care of you, and we're going to get through it all together. Again, any questions, holler, okay? But as of right now, this is everything I know until we meet again soon. Love you guys. Mwah. Bye.